Did you know your risk of a heart attack doubles after the age of 65? That's not a scare tactic, it's a statistical fact. But here's the truth most people don't hear. It's not aging that causes heart attacks. It's what you do or don't do after 65 that makes the real difference. Most seniors don't realize how everyday habits silently affect their heart. The good news, you can take charge starting today. In this video, we'll show you the top 10 powerful habits that could protect your heart and even add years to your life. These aren't complicated or expensive. In fact, most are things you can do at home without medicine. But number one is by far the most overlooked, and it can literally save your life. So if you're over 60 or care about someone who is, this might be the most important video you'll watch all year. Before we begin, make sure to like this video and subscribe, because we release simple, life-saving tips every week just for seniors. Let's start the countdown to a stronger, safer heart. 10. Drink enough water daily. Dehydration might not sound like a heart issue, but it is. When you're not drinking enough water, your blood thickens. That puts extra pressure on your heart and increases the chance of clot formation. Many seniors reduce water intake because they don't feel thirsty or want to avoid frequent urination. But that habit is dangerous. Your heart needs hydration to pump blood efficiently throughout your body. Thick, sticky blood can lead to plaque buildup and increased blood pressure, both major causes of heart attacks. Aim for 6 to 8 glasses a day and more if you sweat or live in a hot area. Don't wait to feel thirsty. Make it a habit. Start your morning with a glass of warm water and sip throughout the day. If plain water is boring, try herbal teas or add a slice of lemon or cucumber. Staying hydrated not only protects your heart, but also supports kidney function, brain clarity, and joint health. It's a small habit that has huge benefits for your overall health, especially after 65. If your urine is dark yellow, it's time to drink up. Keep your heart safe. Don't skip your daily water. 9. Avoid smoking and secondhand smoke. Even occasional smoking or secondhand exposure can be deadly for seniors. Smoking stiffens your arteries, raises blood pressure, and causes your heart to work harder. By the time you reach your 60s or 70s, your blood vessels are already more fragile. Adding smoke into the mix creates the perfect storm for a heart attack. And here's something most seniors don't realize. Even if you quit decades ago, some damage lingers. But quitting now still gives your heart a chance to heal. Within weeks, your blood pressure starts to improve. Within months, your circulation gets better. And over time, your risk of heart disease drops dramatically. Even if you don't smoke, being around someone who does still puts you at risk. Make your home and car a smoke-free zone. If you're trying to quit, talk to your doctor or join a support group. It's never too late. Quitting smoking is the single best decision you can make for your heart, lungs, and brain. You'll breathe easier, feel stronger, and live longer. Protect your future. Ditch the smoke for good. 8. Get 30 minutes of movement daily. Your heart is a muscle, and just like any muscle, it gets stronger with regular use. Physical activity is one of the best defenses against heart disease, especially after 65. But you don't need intense workouts or a gym membership. A simple 30-minute walk every day can lower blood pressure, reduce cholesterol, control blood sugar, and improve circulation. Movement helps prevent blood clots and strengthens your heart's ability to pump efficiently. Walking, swimming, yoga, tai chi, or dancing, all are great choices. The key is consistency, not intensity. Avoid sitting for long stretches. Get up every hour, stretch, walk around the house, or do a few gentle squats. Physical activity also improves mood and sleep, reducing stress on your heart. If you have joint pain or balance issues, start with seated exercises or ask your doctor for safe options. The worst thing you can do is nothing, so start slow, but start today. A stronger heart begins with just one step. Move more, sit less, and give your heart the workout it needs to keep you alive and active. 7, limit salt and processed foods. Too much sodium is a silent killer, especially for seniors. Salt makes your body retain water, increasing your blood volume and putting extra pressure on your heart. Over time, this raises your blood pressure and thickens your arteries, two major causes of heart attacks. After 65, your kidneys aren't as efficient at flushing out excess sodium, which makes the impact even worse. The problem? Salt hides in places you'd never expect, like canned soups, frozen meals, sauces, and even bread. Aim to keep your sodium intake under 1,500 millimoles per day, which is about 2/3 of a teaspoon. Read labels carefully. Choose low sodium versions of your favorite foods. Replace table salt with heart-friendly herbs like garlic, basil, or turmeric. And skip the chips, pickles, and packaged snacks. Instead, eat more whole foods, fresh vegetables, fruits, and homemade meals where you control the salt. Your heart will thank you. Reducing salt doesn't mean your meals have to be bland. It just means you're making a powerful choice to protect your life. Remember, your taste buds adjust in a few weeks, but the benefits for your heart can last a lifetime. 6, get regular heart screenings. Just because you feel okay doesn't mean your heart is. That's why regular screenings are so important after 65. Many seniors don't realize they have high blood pressure, high cholesterol, or silent heart damage until it's too late. Your doctor can detect early warning signs long before symptoms appear. Get your blood pressure checked every few months, especially if you're on medication. Ask for annual blood tests to monitor cholesterol, triglycerides, and blood sugar. If you're at higher risk, get an ECG or a stress test. These tests can reveal blockages or irregular heart rhythms before they lead to a heart attack. Don't skip checkups just because you feel fine. Prevention is far easier than treatment. Regular screenings help you and your doctor stay one step ahead. They also guide your diet, lifestyle, and medication choices. A simple test today can prevent a medical emergency tomorrow. Stay proactive, stay informed, and never ignore the power of routine checkups. They could save your life. 5, lower your stress levels. Stress isn't just a mental burden, it's a heart killer. Chronic stress increases your levels of cortisol and adrenaline, which raise blood pressure, tighten arteries, and weaken your heart over time. Seniors often face hidden stress from loneliness, financial concerns, or health worries. If left unmanaged, stress can trigger inflammation, poor sleep, overeating, and even heart rhythm disorders. So what can you do? Start by adding calming habits to your day. Deep breathing, meditation, or simply sitting quietly with a cup of tea can make a huge difference. Try 10 minutes of stretching or a walk in nature. Talk to a friend. Listen to soothing music. Keep a gratitude journal. Even small rituals help your nervous system relax. Avoid stressful TV or phone conversations before bed. And don't bottle things up. Talk to someone you trust. Your heart and mind are deeply connected. When you calm your thoughts, you protect your heart. Stress may be invisible, but its damage is very real. Make peace and relaxation a daily habit. Your heart needs it more than you think. Before we continue, if you truly care about your health after 60, now's the time to take the next step. Tap the join button below or click the link in the pinned comment to unlock exclusive health tips, early video access, and weekly wellness guides just for members. It costs less than a cup of coffee, but the value could add years to your life. Thousands are watching, but only a few take action. Don't miss your chance. Join now. 4. Control your blood sugar. Even if you don't have diabetes, elevated blood sugar is a major risk for heart disease, especially after 65. High blood sugar damages the lining of your blood vessels and makes it easier for plaque to build up, leading to clogged arteries. Over time, this increases your risk of heart attacks and strokes. Seniors with type 2 diabetes or insulin resistance are particularly vulnerable. That's why it's crucial to monitor your blood sugar regularly, especially if you experience fatigue, excessive thirst, or blurred vision. Eat a balanced diet that's low in added sugar and refined carbs. Swap white bread and sugary drinks for whole grains, leafy greens, and fiber-rich fruits. Portion control is also key. Don't overload your plate. Include healthy fats and lean proteins to stabilize your blood sugar. Consider walking for 10-15 minutes after meals. It's proven to lower glucose levels. If you're on medication, take it exactly as prescribed, and always consult your doctor before making changes. Keeping your blood sugar stable doesn't just prevent diabetes complications, it also helps your heart stay strong, clean, and protected from deadly attacks. 3. Keep your cholesterol in check. High cholesterol is one of the leading silent causes of heart attacks after 65. It slowly clogs your arteries with plaque, reducing blood flow and increasing the risk of a blockage. Worse, many people don't even know they have it. After age 60, your body doesn't handle cholesterol as efficiently, so even a moderate fat diet can lead to high LDL, bad cholesterol. To protect your heart, get your cholesterol tested every year. Aim to keep LDL below 100 and HDL, good cholesterol, above 60. To lower your cholesterol naturally, avoid fried foods, red meats, and full-fat dairy. Instead, eat oats, nuts, olive oil, fatty fish like salmon, and plenty of fruits and vegetables. Add flax seeds or chia seeds to your diet. They're rich in fiber and omega-3s. If diet isn't enough, your doctor may recommend statins or other medications. Don't ignore it. Managing your cholesterol is like cleaning your heart's pipes. It keeps blood flowing freely, reducing your risk of a deadly heart attack. 2. Monitor your blood pressure closely. High blood pressure or hypertension is known as the silent killer for a reason. It damages your heart, arteries, kidneys, and even your brain without any noticeable symptoms. After age 65, blood pressure tends to rise naturally, which makes monitoring and controlling it even more important. Aim to keep your BP below 120/80. Anything above 130/80 increases your heart attack risk. Use a home blood pressure monitor to track your levels daily or weekly. If it stays high, consult your doctor. Don't ignore it. Reduce your salt intake, lose excess weight, exercise regularly, and cut back on alcohol and caffeine. Stay calm during stressful moments and breathe deeply. Even one bad reading doesn't mean disaster, but repeated spikes can cause lasting damage. Remember, high blood pressure doesn't hurt until it's too late. Checking your blood pressure is one of the simplest ways to protect your heart and stay out of the hospital. Make it a part of your weekly routine. Knowledge is power, and in this case, it's life-saving. 1. Take daily action, not just once in a while. The most important thing you can do to reduce your heart attack risk after 65 is this: be consistent. Taking care of your heart is not about one-time changes or occasional healthy meals. It's about daily habits that add up. Every time you skip the salt, drink water, go for a walk, check your BP, or say no to sugar, you are choosing life. Heart attacks don't happen overnight. They build slowly through years of small, harmful choices. But the good news? you can reverse the damage the same way, one choice at a time. No supplement or doctor can help if you don't make the commitment yourself. This means planning your meals, staying active even when you don't feel like it, showing up for your checkups, and saying no to excuses. Your heart is aging, but aging doesn't mean giving up. It means being smarter, more mindful, more dedicated. The #1 way to protect your heart isn't a secret. It's your everyday discipline. Start today. Your future self will thank you. And there you have it. 10 powerful habits that could protect your heart and extend your life after 65. Remember, heart attacks don't happen overnight. They build silently through small daily choices, but that also means you can reverse the risk the same way by taking smart, consistent action every single day. You don't need fancy treatments or expensive supplements, just real simple changes: drinking more water, moving your body, lowering salt and sugar, managing stress, and checking your numbers regularly. These aren't just tips. They're your defense against a future heart emergency. If you found this video helpful, please give it a like, subscribe to our channel, and turn on notifications so you never miss another life-saving health video. And if you're serious about protecting your heart, make sure to check the pinned comment and join our exclusive membership for early access to new videos, weekly health PDFs, and members-only advice, all for less than the price of a coffee. Take control of your heart health today, because your best years can still be ahead of you. Stay strong, stay smart, and take care of your heart.